A list of objectives is provided to assist you in your study. Please refer to the student manuals for further information on removable partial denture terminology. A removable partial denture replaces some missing teeth, whereas a complete denture replaces all teeth in one or both arches. These prostheses are designed to be placed and removed by the patient. A fixed prosthesis is designed to replace or restore a limited number of teeth and is not intended to be removed by the patient.
The Clasp retained partial denture is designed so that it can be conveniently removed from the mouth and replaced by the patient. It restores the partially dentureless arch, is minimally invasive, and affordable. The most common reason for failure is poor diagnosis, but failure may also result from poor lab work or poor impression technique. Temporary partial dentures are also known as provisional or interim partial dentures. They are usually made of acrylic resin, and may or may not possess clasps. They fulfill a variety of diagnostic and treatment needs. This type of partial denture is economical, and in selected cases may be used in the longer term.
Numerous indications exist for the Clasp retained removable partial denture. In patients who will not be treated with end-osseous implant therapy or conventional fixed prostheses, the removable partial denture may be employed. The most common reasons for the use of the removable partial denture are in the distal extension base. That is, an extensive edentulous space unbounded by a terminal abutment. Other indications include long tooth-borne edentulous areas, and patient financial considerations.
The partial denture framework is the cast metallic supporting foundation for the removable partial denture. The framework may be cast from a variety of metals, but the chrome cobalt alloy vitalium is the material from which our frameworks are made.
An abutment tooth is a tooth that is selected to support and retain a prosthesis. A primary abutment provides vertical support to the partial and supports the retentive clasp. A secondary abutment may provide indirect retention as well as some vertical support. In this course we usually will not distinguish between these two terms, however you will see these terms in your reading.
A major connector connects components across the arch. This provides cross-arch support and distributes stress. To appreciate this, imagine cutting the lingual bar in half with the subsequent rotational instability of the components. The main requirement of the major connector is rigidity. In the absence of rigidity, the partial will be unstable and traumatic to the abutment teeth. The lingual bar and a P-strap are shown as two examples.
The denture base is that component which rests on soft tissue and bone, and to which the artificial teeth are attached. Denture bases are of two types, acrylic resin or metal. Each base has definite indications for use, each with advantages and disadvantages.
The rest is a component of the partial denture that is placed in a prepared rest seat. The rest may provide vertical support, resisting movement in a gingival direction. The rest transmits occlusal force to the tooth. The rest may also act to limit rotational movement of the partial denture and as an indirect retainer.
Minor connectors are components which serve to connect components with the major connector or base. In this example, the vertical minor connector circled in red connects the rest to the major connector. Other examples of minor connectors are elements which retain acrylic, such as lateral beads, as seen in the diagram.
Tissue stop, an integral component of denture base retentive elements. The tissue stop provides stability to the framework during processing. Provides stability to the framework during duration record procedures. Should be present on all extension base RPD. Finishing lines are found wherever acrylic joins the metal framework. Finishing lines are found on both internal and external surfaces of the denture, and are generally a 90-degree, butt joint design.
The path of insertion or placement is the path traveled by the partial denture from initial tooth contact until it is fully seated in the mouth. The most desirable path is that path that eliminates interferences to placement and removal with conservation of tooth structure. In most cases, it is helpful if the path of insertion be perpendicular to the occlusal plane of the patient. This orientation is easier for the patient to manipulate, and is generally less complex in design. Guiding planes are prepared or naturally occurring parallel tooth surfaces, which define the path of insertion of the partial denture. The metal component approximating the guide plane is called the proximal plate. It is very easy but inaccurate and confusing to use these terms synonymously. One is a tooth surface, the other is a partial denture component.
The height of contour is a term that describes the greatest circumference of a tooth relative to other oral structures along a given path of insertion. The height of contour will change if the path of insertion changes. The line scribed on the egg represents the height of contour of the egg at the orientation shown. Tilting the egg redefines the height of contour. The height of contour may be described for a tooth as the intersection of the bases of two cones, as shown in the diagram. An undercut area suitable to retain a partial denture is denoted by a red circle. The location of this undercut may change relative to the height of contour by tilting the egg.
The dental surveyor shown in the upper right is a paralleling instrument with numerous uses in dentistry. For clasp-retained partial dentures, it is essential for locating a path of insertion, identifying areas of retention, for locating interferences, and maximizing aesthetics of the denture.
The direct retainer, also known as a clasp, acts to retain the partial denture against vertical dislodgement. Only one retentive clasp is used per abutment tooth. The clasp functions as a retainer by the degree to which the tip of the clasp resists flexure over the height of contour of the abutment. Two different clasp types are shown in this illustration. The retentive tip engages the tooth in the gingival third of the tooth. It should be located at least 1 mm away from the free gingival margin. Usable retentive areas exist on the buccal or lingual of the abutment tooth and range from 0.01 to 0.02 inches in depth, relative to the height of contour.
The reciprocate and clasp or element functions to limit buccolingual tooth movement as the clasp flexes over the height of contour. It is rigid throughout its length and occupies the middle third of the tooth. It also serves as a stabilizing element, resisting lateral movement of the partial denture. It may take several forms: a vertical minor connector, a clasp, or a plate.
An understanding of these three basic movements can simplify the study of partial dentures. The partial denture occupies a dynamic environment under the influence of the structures of the oral cavity. The first movement in the horizontal plane is referred to as fishtailing. Buccolingual movement of the partial denture is both traumatic to the abutment teeth as well as the residual ridge. Stabilizing components may be added to the partial denture to resist this type of movement. Movement in the frontal plane may be described as a rotation about a longitudinal axis through the mandible. This movement is resisted by maximally extending the major connector around the arch, having a rigid major connector, and components that are well adapted to their supporting structures. The third motion, rotation in the sagittal plane, is described as rotation about the fulcrum line. This typically is the most obvious that may be noticed, although all of these movements may involve low-magnitude forces, which are very destructive over time. Rotation about the fulcrum is minimized by ensuring that indirect retention is planned, and that well-adapted bases are provided.
The fulcrum line is an imaginary axis around which the partial denture rotates whenever the patient closes. It will be present whenever an extension-based partial denture is indicated. The fulcrum line is of chief diagnostic importance in planning for the partial denture, and must be identified when present. It generally is a line running across the arch through the most posterior rests adjacent to edentulous spaces. When the partial denture is subjected to loading, elements of the partial denture on the extension base side move tissueward, whereas elements on the side opposite move toward the occlusal. Understanding this phenomenon is critical, yet simplifies the process of clasp selection.
The indirect retainer resists movement of the partial denture occlusally through lever action. It is located on the side opposite the extension base, perpendicular to and as far from the fulcrum line as is reasonably possible. Indirect retainers may take many forms. The abutment circled in red supports the indirect retainer, which in this case is a rest.